The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone, and welcome to our webinar. My name's Karen Bowness. I'm the Marketing Manager here at MedTech, and I'll be your webinar moderator this afternoon. Today's session is the fourth in our Practice Growth series. We've had three others. The first was an overview. The second, we looked at medical marketing. And the third one was policies, procedures, and systems. And today we're going to be looking at planning for growth. So to help us take a deep dive into that really important topic, I have with us our education partner, Stephen Makarunas from the Private Practice. Hi, Stephen.
Hello, Karen. Hello, all.
And our financial whiz for today, Julie Smith from Grant Thornton. Hi, Julie.
Hi, Karen. Hi, everybody.
And of course, last but definitely not least, our National Sales Manager and Technology whiz, Ben LeGros. Hi, Ben.
Hi, Karen. Hi, Karen. Hi, all.
Hi. So today we're here to talk about practice planning or planning for growth. Really timely. This is our last webinar for the year, so hopefully it will finish off the year with you thinking about how you can grow your practice and put some plans in place for next year. So let's have a look at the agenda for today. We're going to start with a little bit of housekeeping like we always do. Those of you that are regulars know what the agenda usually looks like. Then I'm going to pass over to Stephen and Julie to talk to us about planning for growth. Then after they've finished, they're going to pass back over to Ben, who's going to talk to you about how you can use your PMS for growth. And then lastly, we'll look at any questions and hopefully give you some answers to finish up with. Now, I've seen Julie's slides and she's got some great information for you, so I hope you've got a paper and pen. I also have put a link in the follow-up email that you'll receive an hour after the presentation that has a link to Julie's slides and also to the MedTech slides. We are recording this presentation and it will be released in the coming weeks or week for you to be able to watch in case there's any important bits you wanted to see again. So let's start off with looking at the control panel for GoToWebinar. Everyone should have a control panel that looks a little bit like this. It usually sits in the top right-hand corner, but if it's floating on your screen, you can always click on it and drag it to the right. The important things you need to know about are these ones here. This arrow, orange arrow, allows you to minimize the control panel so you can see the full screen. The next option just tells you that you're in mute mode. The option below that is a window or a screen. If you click on that, that will minimize or maximize the screen with our slides on it. So we've got lots of lovely slides today, so a good idea to maximize that window so you can see them all. The next one is hand raising. If any of our presenters ask you to raise your hand, just click on that option and we'll be able to see those of you that are. If you have any questions for us throughout the session, please just type them in here where it says enter a question for staff and send. All of your questions will be anonymous. We won't mention your name or practice when we talk about questions later, so please don't be afraid to ask a question, worried that it might be a silly question, because there are no silly questions. And we want you to get the best out of the session today, so please do ask us those questions. As I mentioned before, we've partnered with the Private Practice for this Practice Growth series, and our presenter has always been Stephen Makarunas. For those of you that don't know Stephen, he has over 30 years' experience providing education and advice to healthcare professionals. He holds a Bachelor of Commerce, a Diploma of Financial Planning, and is a founding partner of the Private Practice, Australia's premier medico-specific business, financial and lifestyle educator. And he's invited one of his education partners, Julie Smith, who is a partner at Grant Thornton, to present to us today. Julie has over 25 years' experience working with clients to help them maximise the success of their businesses. As a partner in Grant Thornton's private practice advisory team, Julie's focus is to help her clients understand complex taxation and business issues to assist them in managing the implications for their businesses and personal affairs. Specialising in the health industry, Julie draws on her considerable experience to deliver strategic advice to assist clients navigate the various issues within their business. As a chartered accountant and chartered tax advisor, Julie regularly presents education seminars to the medical and dental industries on relevant tax and business issues. So I'm so excited to pass over to Stephen Macarunas and Julie Smith. I'm just passing the slides now. And welcome, Julie and Stephen.
Thank you. Thank you so much, Karen, and welcome everyone. So let's get started. There are two crucial inputs to efficiently and successfully achieving any objective, and this is most certainly the case for practice growth aspirations. These inputs are: 1, defined goals, and 2, good advisors. Now, the thing about defining your goals is that often, and especially for doctors, we don't know what we don't know. So it helps to have advisors that can show us what's possible. And when it comes to advisors, one of the most important in your life should be the medico-specialist accountant. So this brings me to our lead presenter for today, Julie Smith. Julie's going to do all the talking today when it comes to identifying opportunities for growth, because Julie is just that, a medico-specialist accountant with significant expertise and a long history of working side by side with me in presenting to these themes, addressing these challenges via the private practice course curriculum. So, Julie, I'm going to hand over to you to help us understand these two crucial inputs, the importance of defined goals, what are the things we should be striving for, and the value that can be added in achieving these goals by aligning ourselves and building into our team of professionals, good advisors, namely someone like yourself. Over to you, Julie.
Thanks so much, Stephen, and welcome to everybody. We've got about half an hour together, and obviously, gosh, I could talk about this topic all day long. It's actually helping businesses to understand their practices better and develop them, and to look at this area of growth is one of my favourite topics. So I shall try very hard to keep it just to half an hour. And effectively what we're going to do today, obviously we're just covering off on some general information. Very happy to have a discussion with you all about your personal circumstances, but there is no one size fits all. So it's important to just take that general information and have a think about it in your own context. What we're going to talk about today, as you know, I've been introduced, I do specialise in primary care. I spend a lot of my time talking to practice owners, and there are really common themes that come out of the issues that practice owners are facing, and also what motivates practice owners. Often, what I love about this industry is what comes first for practice owners are looking after your patients and your team. We love that. I love working alongside such a passionate industry. But often there's also this discussion about how do we secure the future of our business, particularly with government funding changes and indeed changes of government that then have a different policy. There are a lot of headwinds in the industry, and all of the practice owners that we talk about, for their patients and their team, they're wanting to secure the future of their business. Often in that discussion, there's a discussion around, well, is growth the answer? And indeed, is growth always the answer? So as a business owner, you'll often have a discussion. You hear people say, look, I heard I want to grow my business. I should grow my business. But I think what I want to do today is really sharpen that up a little bit, is to step back and think about, well, if you are going to grow your business, what does that mean for you, and in what areas should you be focusing? So what we're going to talk about today is 4 key areas. We're going to talk about what does success look like for you and getting some real clarity. As Stephen mentioned, I would agree with him. The most important thing is to have clear goals. And even as an advisor, I talk to my clients and say your advisor's role is to help you achieve your goals. So the more clear you can be on what your goals are, the better chance you have of getting advice that's tailored to what you want to do. So we're going to spend a little bit of time on that. Sorry, go for it, Stephen.
I'm going to interrupt just briefly. I was going to just very excited to I just want to reiterate that often, and I'm sure you see this all the time, your clients will come to you and not know exactly what their goals should be. They've got an inkling that they need to grow, should grow, don't quite understand how, what they're aspiring to. And again, the role of the advisor is to clarify, to provide options and help you to choose in a collaborative fashion, you know, what you're trying to achieve. So yes, the more clear you are, the better, but sometimes that clarity comes through a mutual conversation, a collaborative approach in conjunction with your advisors.
Yeah, I couldn't agree with you more, Stephen. I think it's okay if you don't know what your goals are. I think it's important to have, sometimes you go to an advisor and you're expecting them to tell you perhaps what should you do, and you think, well, why are they asking me all these questions? It's really trying to help you either tease out what your goals are or to clarify them so that we can give you that tailored advice. So we'll talk a little bit today around what does successful growth look like and the different areas of focus you can have. Then we're going to talk about my favourite topic, I am an accountant after all, around how do you use data in your practice to help you identify growth areas. Then cover off on how do we realise those opportunities and how do we know if we're being successful. So we're going to try and do a fly-by-night on that in 30 minutes. So let's get stuck into it. So what does successful growth look like for you? So obviously, as we've talked about, it's going to be different things for not only different people and personalities and backgrounds, but also different practices. We've got a mixture of attendees today in general practice and in different other specialties as well. So obviously it's going to be different if you are, depending on what specialty you're in. So what we're going to talk about is, if we're going to say, well, what does successful growth look like? I see successful growth has a number of different focuses. So for example, one of the things that you might look to grow is your revenue. So that's a good one if you are more in the startup phase of practice. So you've got some costs you've got to cover and you need to get to a certain amount of revenue. Or my favourite one, which is where you can actually, you can increase your revenue by a certain amount before you have to increase your costs. And so often what that can do is lead to a growth in profit. So obviously it'd be lovely if revenue, the more revenue the sweet spot is you grow your revenue, which means you grow your profit straight away. It's not always the case. So some people might be more established, but they're concerned about changes in the industry and how it might impact upon them. So their focus is on growing profit. Another one you might look at is where you might want to grow the type of patients that you're wanting to see or the number of patients. So that might be because you've got a niche skill set and you're after you're wanting to increase your number of referrals for that niche skill set, or alternatively, you might want to look at offering a new type of service. So often the growing the type of patients is well suited to specialists, and then the growing a different type of service offering is well suited to those practices where they're in the general practice specialty. The other one that I wanted to put on here is where you may also want to grow the number of doctors that you have or the type of doctors that you have to aid in succession planning. So that might be for practices where you've got a number of established doctors and you've identified that you might look to either have a changing of the guard, or you might be looking to sell at some point in the future. So you're really wanting to boost up your number of doctors and both optimise the practice and also give you some good options from a succession planning point of view. So as you would imagine, these different areas of growth mean very different things for both how do you identify opportunities, what kind of advice do you need, so that we can tailor the rest of our presentation today. What we're actually going to do is a poll. We'd love to hear of those areas we've covered, which one do you think, if you're, obviously you've come to this for a reason, you've come to this presentation for a reason, so we're keen to find out on the whole which of those 5 areas is most relevant for your practice as to why you've come today and what you're hoping to get out of it. So if you all wouldn't mind letting us know, it's a bit of a live poll. So at the moment,
it's anonymous to
sorry,
everyone. It's anonymous, so we can't see who's saying what. So just so everyone knows that their input is anonymous.
Okay. So we're getting to a fairly steady. This is one of those wonderful live polls I get to see people's thoughts. So clear winners so far is profitability, which is not surprising given the issues that are in the industry at the moment. Interestingly, the next one is number of doctors, followed by type of patient and then revenue. So at the moment, we've got about a 40% of you are most interested in profit and probably 20% on the number of doctors and about 16% on type of patients and 14% revenue. So by far, profitability is the issue. So that's really helpful for me. Thank you, everybody, because it helps me to shape what we're going to talk about next. So what I wanted to talk to you about, this is a little bit of a point of reflection for you. So when you're thinking about your profitability, and obviously we're talking around also that revenue and the type of patient as well. Those other areas don't drop off just because we want to think about profitability. But when you're thinking about, well, how on earth do I grow and what do I do in my business? It's really around, I think it's twofold. It's around what is your business today and then what is your business of tomorrow. So some of you might be familiar with the McKinsey, is a big consulting firm internationally, and they've got a 3 horizons model for growth. And you can Google it and have a read about it. It's an interesting one because it talks about thinking about not just the business of today. So it's got 3 horizons. The first horizon is what you're doing right now, the business of today. The third horizon is, you know, that mountain right off in the distance there, which is the business of tomorrow. And the second horizon is a little bit around, I think of it as a bridge. How do we bridge between our current business and what we're doing and the future business? And the business community is full of examples of areas where people have done this well and where people have done it not so well. So I know we've all heard, probably you've all heard at a seminar of a sort around the good old Netflix and Blockbuster example, and I'm not going to talk about the death of videos, but what I do want to talk about, interestingly, is Netflix. It gives a very good example of what I mean by that 3 horizons. So obviously when Netflix started their business, that business was a DVD hiring business. And they didn't just jump to streaming. Streaming was their business of tomorrow. What they did is a midpoint, which was around what is how do I get from people hiring DVDs to actually getting people to think about streaming. And interestingly, when you look into the Netflix business model, they started that as a DVD by post system. And what that did is really change that people don't have to go to the DVD store to get one, and they can do it in their own time. If they like the movie, they can watch it 4 times, etc. There's no late fees. All of that model was introduced model to get them to their end goal. So I think whilst we're going to talk about profitability and we'll talk about talk about it from the point of view of data, what I really wanted to think about, challenge you to think about the business of today and the business of tomorrow. I often talk, I ask lots of questions. I'm one of those annoying people that ask lots of random questions to colleagues, people that I've come into contact with in the industry, because I'm interested to know how people perceive the primary care industry. And interestingly, when you talk to a lot of younger professionals, for example, it's all about that convenience. And we've been talking around some of the innovation that will become available in the medical space. And I know we've all thought about the telehealth opportunities, but that's a good example of, although the changes with the Medicare rebates recently opening that up to rural, from a Medicare rebate for rural patients, that's an example of looking about growth from an innovative framework, because I actually think, for example, there would be plenty of professionals that would be happy to pay, even though there is no current Medicare rebate, for the convenience. So that's around matching the business of today. Medicare rebates was such an important aspect, but there is an innovation piece as well, that thinking about that business of tomorrow. So that was just a thought about that. So if we have a look at moving on to how do we identify potential for growth, this is really about, if I could make one suggestion to you today, I would say, irrespective of how you want to grow, whether it's doctors or services or revenue or profit, the key to all of this is really understanding your business. Get to know your business. And the way to get to know your business is see what lies beneath the surface. And that's why I actually have one of those sneaky medical photos there around some imaging that's done. So I often give this as an example. Whenever I've had an ultrasound for any reason, I'm always amazed at the sonographers. I have no idea how that grey fuzz tells them anything. And what happens with any kind of imaging, ultrasound and grey fuzz included, is that it is telling you a story about what's going on underneath. And as an accountant, I would say that your numbers and the data that comes out of your practice tells you a story about what's going on underneath. So the way that you might not know how to read that story, just like I don't know how to read ultrasounds, and that's okay. It's really around working with your advisors to work out what that data is telling you. What is the story that the data is telling you? And so what we're going to do is spend a little bit of time having a look at that data. What data do I think is important? Because I promise you, your data is telling you a story. And from a profitability point of view, obviously, cost is important. But I have a little saying, you can't cost cut your way to profit. You can certainly improve profit by managing the cost, but there will be a little bit of that law of diminishing returns. You'll get some gains by cutting costs, but you need the rigor. We often want to go to costs first because we feel most comfortable with costs, because it's something a bit tangible. We can understand it. If we cut this, then we'll get more profit. But the rigor with which you approach that cost-cutting exercise, if you can also apply that rigor to really understanding what your revenue data is showing you in your practice, that is just as important. And I would actually, my view is it's more important, because it can have a greater impact on your bottom line. Once you've cut out those obvious costs, the real power is in working on your revenue numbers. So obviously qualitative data, and we'll talk about that with our patient satisfaction information and all of those things. But if I could do anything, if I could somehow switch on your curiosity about your data today, I really would encourage you to do that. Just think about all those questions that you wonder. I wonder what's this? I wonder how many of those patients we see. I wonder who our best referrers are and why are they our best referrers. What I find with data, I love data, but I love it because of the story that it tells us. And I actually find it gets a little bit addictive. So once you start, I do this with a few clients, and I have one client in particular who their practice manager is just loves data as much as I do. And she and I have some fantastic discussions. For every piece of data you get out, it often makes you curious about other things. So let's have a look at some of the data. So what this is a little bit of a table. Obviously, there is lots of different data that you can pull out of your practice, and this is by no means an exhaustive list. But this is a good place to start. And as I said, what it will often do is then promote some more questions about different areas. So what I've listed here on the left-hand side is the data, what data you can pull out, and on the right-hand side, why I think it's important. And some of these are more obvious than others. So we're just going to go through this line by line. So if we look at our billings, Dr. Billings, that's a nice, easy place to start. Why I think it's interesting with Dr. Billings, and I would probably, the next line, fees per patient, they're probably linked. But what those two are trying to do is, yes, it's going to show you who your top performers are, and that's pretty obvious. Like you probably will know that other than your data. Where I think it gets interesting though is when in a GP practice, if you're looking at this data from a point of view of your registrars, if you're monitoring this data regularly, you get to see some trends in, for example, your reggies. How quickly are they learning? How quickly are they applying what they're doing? The other thing that I think is interesting from your doctor billing point of view is that it also shows you some doctors are fantastic at innovating how they deliver services and creating subspecialties for themselves. And so this really gives you an indication of how they're going with that. Now, fees per patient, that's good. The one thing that I would say about fees per patient, that I would really encourage you to not just do that on a holistic basis for your practice, but to really look at it, use your doctor billings and your patient numbers per doctor to look at it on a per doctor basis. And what that does is really show you where the opportunities might be for doctors that are doing things a little bit differently, doing it really well, and how you can perhaps leverage those skills in your practice, whether they can teach the other doctors. And conversely, you'll be able to see doctors that might need some support. So the item number usage, that really shows you where your skill sets are, and it also shows you where support might be needed. You'll be able to see, again, in general practice, you'll be able to see whether or not certain doctors need some support with their billing, whether they feel comfortable to bill for the work that they're doing. The referral sources, for those of you that are in specialist practice, if you are not tracking your referrals, and I don't perhaps mean just numbers of referrals, I would really be looking at what type of referrals are they sending you, because then it's important to give you the opportunity to broaden out, to contact those referrers and say, actually, thank you for sending me these. These are the exact kind of patients I'm really well suited to looking at. Or even to say to them, actually, you're sending me a lot of these patients. Did you know I also do these other procedures as well? So the patient satisfaction, that's that qualitative piece. It's really important to ask your patients about, obviously you need to do those patient satisfaction surveys, but it'd be good to think about throwing in the odd question around types of services. Is there anything else you would like us to be doing for you? The last two, if I flip those around a little bit and let's talk about cost per service offering and profit centres. Since we're focusing on profitability, these would be the ones that I would say absolutely spend a bit of time with your advisors looking at these. So what you want to understand by profit centres, that's accountant jargon. What I'm trying to work out, if you've got a profit each year what parts of your business are driving that profit. So there's going to be obviously an element of your government, like for general practice, your government subsidies, there's like your PMIC, etc. There's going to be your registrars, your contracting doctors. For specialist practices, I actually think it would be really interesting to do some dissection around your consulting income versus your procedural income to just see the proportion of time that you're spending. And you do that obviously in conjunction with that item number usage. But you really want to understand what adds the most value to your business. And that's also, for example, around those cost per service offerings. So if you're doing a lot of work like skins work, and how I think it'd be really interesting to work out, for example, what you're billing for that skins work, how many nurses, what are the consumables, what other things do you use, what is your cost of delivering those services, and that really helps you with your pricing. So obviously there are constraints on your business around, that patient expectation, around scheduled fees for things. And I'm not suggesting that you throw that out by any stretch, but I think it's really important for you to understand what it costs you to deliver your services so that you can work out where you want to put your effort. And certainly from a profit centre point of view, what adds the most value. And for general practice, for profit centres, where it becomes interesting, if you, again, data tells you a story. So profit centres are really interesting because you can look at the trends of your profit centres depending on, for example, with your registrars, what level registrars you have. If you can build some trends over a number of years, you'll be able to see whether you always do well with certain levels or whether or not it really depends upon how you support those registrars. If you change the way you support them, does it change how they perform or doesn't it? All of those kinds of questions, your data is your friend, and it tells you it tells you a story of the data is just the outcome of all of your effort. So if you're not tracking the data, then you don't necessarily get any feedback on whether the effort is working for you or not. So we're going to move off data. You could tell I could talk about it all day. I love it. So we're going to talk now about how do we realise these opportunities. So you say, that's great, Julie, I've done all this analysis, now I have no idea what to do with it. And I think what you really need to think about when you're realising opportunities, a little bit like what we were talking about, really being clear on your goals and why. So a lot of you have said, 40% of you is that you want to improve profitability. You will, even within that one goal, there will be different reasons as to why. So I think really getting that clarity on your goals and using the data in your practice to get you some clear focus is really what identifies the opportunities for you. And then when you're saying, okay, I've got this opportunity, but I don't really know, I'm going to think about how I'm going to implement it. Some of the things that I think is important to think about is obviously, do you have the right team and the right funding, and what else is going on in your industry? So obviously, again, if we think about some of the industry type issues that we see, it's no secret that obstetrics has really been struggling over the last few years with the drop-off, so with the number of patients that are choosing to go with private obstetrics. That's something that's very specific to that specialty that may not be applicable to other specialties like surgery or cardiac or something like that. What we are seeing in the general practice industry, of course, is a lot of discussion around the M changes with where rural is, and that's driving a lot of discussion for any of my clients that are affected by that around profitability. How do we grow revenue? What else does that mean for us? There are pressures that you've got. So there's going to be pressures that are specific to your specialty. But I think broadly what you want to think about is once you've worked out an area of growth, and whether it is actually, for a specialist, for example, we're going to invest in some time to really focus on our referral networks, or we're going to do some really targeted investment on our marketing. For example, we might ramp up our website, all those kinds of things. I guess I would be really keen for you to try and articulate what you're hoping to gain out of those things, because if you've got an articulated goal, then you can really monitor success. And then you can go to your advisors and say, hey, these are the goals that I've got. This is the investment that I think I'm going to need to make. And you can have discussions around how you fund that. Have discussions with your team about, do you have the skill set within your team to invest? So often it's really easy to talk about a lot of these things, but having that discussion around what do you need in order to really focus on it is important. Lastly, that question around, is this something that I can scale? What I mean by that is, for example, parts of your practice that you might look to develop and grow and potentially generate even more revenue from. So where it's easier to do that, for example, if you've got some services that you offer that don't have Medicare items, so for example, injectables or some other kind of cosmetic, aesthetic kind of services that don't have any, or that may or may not have Medicare items, might be easier for you to manage patient expectations than those where you do have the constraints of the expectation around scheduled fees. So those kinds of areas, when you're identifying what you can do, it's important to think about also, are there ones that are easier to scale than others? Okay, so if we keep going, this is one other question that I want you to think about and answer for yourself. And really, it's a little bit like that horizons thinking. And the question I'd love to ask you, or to have you ask yourself, is that if you started your business again today, right now, would you do it? Would you start exactly the same business? So if you had a choice right now, thinking about the future and thinking about how you'd realise these opportunities, would you start exactly the same business right now, or would you start something a little bit differently? And that's just trying to challenge you as you're going about realising these opportunities. It's easy to stick with the safe ones, and sometimes it's wise to stick with the safe ones, but it's also good to challenge yourself and say, well, if I was starting a brand new business, would I do it this way? So then if we move to monitoring success to finish up. So monitoring success actually is a little bit easier than what you would think. Really what that's about, if you've got very clear goals, you're using the data in your business to show you where to focus. You're talking to your patient, working out if you're successful, that data will start to tell you a different story. And there's so much technology around to get really live data out, that this data should really be something that you start to live and breathe. I promise it doesn't have to be pages and pages of numbers. It can be some really good dashboards and graphs that you just watch. And in every client that we work with in this, you start off monitoring, and then the curiosity just gets more and more and more heightened, and the data becomes fun to manage. So that's really around how you're going to monitor success. So in terms of where do we start? This is my thoughts on a roadmap as to where you would start. Whether this is around looking at new service offerings, increasing your revenue, profitability, no matter what, looking at getting some new doctors. No matter what, I actually think this is a roadmap that would apply to all of them. So the first one is around that, as we've talked about, it's a bit of a summary of today. Be really clear around defining what your growth is, firstly. Secondly, really spend some time analysing your data, and then making some really clear and deliberate considering what your options are. and then you set a really clear plan. And that's actually the hard part. Monitoring success is, in my view, relatively easy. Once you've made a very clear goal, you know what data you're going to watch, you know how you're going, made a decision about what you're going to focus on, and you set a clear path. And the last thing I would say is don't be afraid at all to reach out and speak to your advisors about it, because sometimes data can be an ocean of data. So trying to work out in your practice where to start is sometimes tricky, and you might want to soundboard that with your advisors. So you would really ideally want to be finding the right person either within your practice, you know, one of your colleagues, to really soundboard what that defining your growth, and then working out where you need help after that. If anybody, I love this topic, so if anybody would like to chat about it, I'm very happy to have that conversation with you. And Stephen, I might just hand over to you. Before I do, feel free as we continue, if anyone's got any questions, we will have a short Q&A at the end. So feel free to ask any questions that you would like to, and we'll come back to them at the end. But Stephen, I'll hand over to you now just to kind of finish off on this topic.
Thank you, Julie. Thank you. And what an incredibly heroic effort to fit so much information into such a short period of time. One of the characteristics of a great advisor, of an extremely good advisor, is their ability to make complicated things simple. And I think, you know, again, despite the amount of content in a short period of time, Julie did a fantastic job of that. Anybody interested in delving deeper, wanting to understand more about, you know, what Julie's talking about, please feel free to attend any of our, you know, education initiatives in 2020. And following this webinar, we will be sending you materials around that program that is, I guess, from masterclasses through to even more comprehensive courses, many of which tackle these issues around growth, knowing what to aim for and how, in conjunction with the right advisors, you can achieve those goals. So thanks again, Karen. It's my job now to pass on to Ben. Ben's going to provide information around growth strategies as they relate to technology. Ben, can you please take it from here?
Thank you for that, Stephen, and thank you for that, Julie. There are so many synergies with what Julie's just presented when it comes to practice management and the data side of it. The amount of data and information going into the practice, you've got it there, you just need to be able to take full control over it. So my presentation's around that side. So really, we're going to focus on the innovation first, the technology that's going to provide that information and scope to grow the practice. And second, the data. Julie said it so many times in her presentation, and like she said, she loves data, and she gets her practice managers to love the data as well. We try to extract as much amount of data in our practice management system to give our customers the ability to see what's going on in their practice. And there's a lot of data coming out, but there are ways to look at it, and there's ways to gather it, and there's ways to make sure you're getting the right information out of your practice management system. So we're going to explore that a lot further. First thing, we can look at the workflow, the innovation workflow, where the data is coming in and how you can actually present it, look at it, and get a good feel of what's going on in the practice. So I'm going to give you one example today, but taking that example and then manipulating that to show other information and other data sets is what really is going to give you the best opportunity for the practice. So in the first part, the workflow bases around the patient self-service, the information coming in from your booking engine. The patients are giving you the information. Why are they coming to the practice? What is their issue? And when they're checking in, that you can give them surveys. You can ask them questions about why they're there. Are they a smoker? What's their feel at the moment? Happy, bad, sad, all those kind of things can be gathered through a kiosk machine and through your online booking. We have a fantastic patient portal that plugs into our practice management software, which leads me into the next side. That's another way of gathering information, either remotely monitoring your patient, having telehealth consults, big keyword, telehealth at the moment. Everyone's talking about it. Remote monitoring. You've got aged care facilities on the books where you want to gather the information from them. You've got a patient with high blood pressure, high diabetic, needs to be monitored, and you don't want to keep them coming back into the practice. You can get them a Bluetooth blood pressure device and plug it straight into our patient portal and get that data straight in and find out how many patients you have on chronic disease management plans and manage them accordingly. Repeat prescriptions. A patient's out in a rural area, can't come into the practice to collect their prescription. We can send a digital prescription. And that's another thing the government's implementing at the moment, which is electronic scripts. So in the next coming year, we'll have the ability to do a digital script. No more having to pick up the paper with the signature on it from the pharmacist or the practice. You can just walk straight into the pharmacist, give them it on a tablet or a phone, and they can give you your script straight out. So from there, you're going into digital data, digitizing the patient information. Everyone at their desk, when I go into a doctor's rooms, you see their filings. They've got a bunch of inbox and outbox documents on their desk that they have to manage by paper. Take that and put that into the digital system, giving you more information in the software. You don't then need to scrape through all that paper and try to figure out what's going on in the practice. You've got it all there in one place, and all you need to do is get it out. How to get it out? Very simple. Use a reporting engine. A lot of practice management systems have basic reports. Some, like the one we have, give you the ability to pull any type of data out. No matter what type of data you've got or what you're trying to grab, you can pull it out, and then you can actually create dashboards from it, which leads me to the next thing. Dashboards, giving you the information in a readable format. And I'm going to show you a basic dashboard after my next slide, which gives you the information that you need to know to make your clinic more profitable and better workflows for you. One of the lead innovations we have, like I was talking about, is a patient portal. Basic things like accessing and maintaining their own medical record. You can still upload to the My Health record, that's fine. But if you want to access other information and keep your information private, you can still keep your own kind of portal, which we give to our customers. So the patient can have all their information, their scripts, their lab results, and even their clinical information stored on a basic iOS or Android application. They can do their appointment booking with their doctor and nurse and keep their preferred clinic on the app. They don't need to go to their website. They can just go straight into the app and make a booking with their preferred doctor or nurse at one click. Okay, so it keeps patients coming back and it keeps the patient engaged with the practice. Requesting repeat prescriptions, which I brought up before, you can have them digitally now. View lab results. If a patient has a good lab result, you can send it them and say, your lab result came back fine, you don't seem to have high blood pressure, I recommend maybe some more exercise or something like that. Secure communication with an allied health professional or normal health professional. So if you're a GP and you're sending the patient a referral to go to see an allied health or specialist, you can communicate with those allied health professionals through our portal, and you can connect them all together in type of a care plan management scheme, where I could say, I'm the GP, I feel this patient needs to have maybe some physiotherapy and maybe go see a specialist. You can connect them all together. We can have an in-depth conversation with the patient and see all the patient's information in one place at one time. So we can make it a good decision for the patient's best outcome. Managing the health goals and setting up tasks and tracking results. Everyone these days has an Apple Watch or a Samsung or Fitbit or a type of device that's measuring their walking distance, heart rate. These things can all be plugged into our portal that gives the practice and the patient more information about what's going on, okay? It then gives another way of actually accessing the care plan. So we have a patient, like I was saying before, diabetic, has high blood pressure. Let's say we want to make that patient walk 4Ks a day. We want to make sure he's doing that. We can plug in a device like an Apple Watch and actually make sure that that patient is actually hitting those goals as part of the plan to make his health better. Accessing health content, information sheet, giving information to the patient, fitness regimes, stretching, things like that. We can send through to their portal as a PDF document, and they can access it and then follow those information content. Receiving recalls and appointment reminders. A lot of you have SMS, okay? We can use a patient portal without even having the cost of SMS on there, because it's doing it through notifications in the actual portal on their phone. These days, half the apps on my phone are sending me notifications. You haven't logged in the last 2 weeks. You haven't done this. So imagine that coming up through a portal, saving you on SMS costs. And providing select access to specialists and community health workers. I brought this up a little bit with the health professionals, giving access to everyone in the story, making sure that everyone knows the best outcome for the patient and how to help that outcome. And monitoring patients remotely, again, using those devices, using equipment that's from the practice that plugs straight into the patient portal, and giving the doctor and the nurses all the information that's needed to make reasonable outcomes for the patient and make sure that the patient gets the best treatment that they can get. Now, going over Julie's side, the data, using the data to make informed decisions, okay? You've got all this information coming into the practice. It's coming from all these sources, coming from your referrals, it's coming from your labs, it's coming from online bookings, it's coming from the information word of mouth. And you need to somehow populate that and look at it in a very simplistic form. You can look at it on an Excel spreadsheet, but half the time you're not going to find the information you want. So what I've done is basically create a dashboard. I've done it through an Excel program. I've taken the data out of a MedTech demo site, and I've got the metrics out of what type of appointment is made. Now, you can see by the data, a lot of it is around mental health. So the practice uses that information to say, well, I seem to be having a lot of mental health consultations in my practice. How do I best manage that? Do I get more allied health psychology into my practice? Do I look at my referrals coming in? Are they referring them into me via mental health? Am I sending them out that way? What type of patients are they? You can see that I've got a lot of new patients coming in, both female and male. It's quite balanced. So look at that data, pull out that information. It doesn't have to be around consult. It can be around anything. It can be like Julie was saying, those key things you were looking at, the type of referrals coming in, your highest number of items that you're billing. All those things can be put into a basic dashboard, and you can present it in your weekly meeting to the staff and management of the practice and say, well, we need to kind of market more towards this, or we need to use this information and make it more profitable for us. It's just a way of really looking at that data, understanding it in a real simplistic form, and then using it to your best ability. So kind of relating that to MedTech, we offer that full kind of solution. So we don't just give you the practice management software. And what I've been talking about is all those kind of things in this chart that I've got. We provide the whole solution. So we provide the practice management system. We provide the patient recalls and reminders. We provide the online appointments. We can view the lab results and the repeat prescriptions and the patient record. And we can also offer the remote health monitoring and telehealth consult. So you've got that full circle of life there with the patient within the practice, able to look after the patient while they're in the practice and while they're actually outside of the practice. So you're getting that data while they're there, and you're getting that data while they're not. So you can make informed decisions using that data, using the full circle, to find out where your patients are going, what your patients are doing, and how best to look after them, and how to build that practice and make it more profitable and a lot more revenue and more patients coming in, more patients coming back, and that will always help you grow the practice. Using all that kind of data you've got there will really help that practice grow, make it more profitable, make more revenue, more doctors will want to come on board. It's kind of a ripple effect. The more you do, the better it becomes, the more that happens. So from there, if you would like to know more about our solution and more information about how MedTech can do the things we've spoken about and how we can use the data like Julie spoke about, feel free to do the exit survey. We're happy to do demos for you and show you how we can build those dashboards. A few of my customers have attended this demo and they'll probably want to see how I created that dashboard. And we can show you how to do that as well. But our software, again, like I said, it's a very data-enriched PMS where you can manipulate and look at the data from all angles and get it out and make informed decisions, and then use that too to get more funding. Go get government projects, talk to your PHNs, show them the data. There's a lot of funding going on in the market today where data is the big thing. Use it and use it wisely, and your practice will be better off. So that's me basically done. We'll pass over to Karen to go through the questions, and hopefully we can answer some of your questions.
Thanks so much, Ben, and to Julie and also Stephen. That was a great session. Now we need your questions, folks. I haven't had very many questions this session. Everyone must have been giving you the information you needed. Does anyone have anything? While we're waiting for that, I will remind you that when you exit, we do have a survey. If you can fill it out, that would be great. It helps us to build these sessions and work out the types of content that you'd like us to present to you. As I mentioned earlier, this is our last session for the year, and we will be starting off again with growth strategy number 4 in February next year. I think the 6th of February I'm looking at. So I've yet to speak to Stephen about that, so hopefully that's okay with him. Keep an eye out on our Facebook page for the dates. I usually release them before the emails go out on Facebook. There doesn't seem to be any questions. Did you have anything you wanted to add, Stephen or Julie, Ben?
Yeah, questions come up.
Yep. What is it? It's how to focus on a goal if we have just contracted doctors. How to focus on a goal if we have just contracted doctors.
I can answer that one, Karen. I think that's a great question. I think what I would say is often in practices, every practice, depending on the personality of doctors, will have a different viewpoint around how you focus on data. But I think the contracted doctors are under just as much pressure as the businesses, because particularly coming out of the impacts of Medicare freeze and the ever-increasing gap between Medicare rebates and also cost of living. So they've got the same issues on a personal front as what you do on a business front, where they've got increasing costs, but their revenue they're really impacted on whether their revenue can climb. And given that your contracted doctors actually keep the lion's share of in general practice, they keep the lion's share of the revenue that they generate, this can be a really good way to approach it from that point of view, because it can be a win-win. And they actually win more than what the practice does. And the practice can really help their feeling of being supported. If you say, look, we really want to help you develop your practice. They're a contracted doctor, so it's their own practice just as much as it's the broader practice with the registrars, etc. So I think it's about sitting down. You may not want to do it in an open forum. You might want to do it one-on-one with the contracted doctors, but using the data to talk to them about their practice, how it's going, how you can help support them, and showing them the impact it could make for them personally. For example, if their revenue grew, that's going to really help them. So I think I wouldn't be afraid to have those one-on-one conversations with them, because I think that will help.
Thanks, Julie. Another comment was, if I could start again, I would split the business in 2 sections, 1 for general care and 2 for subspecialism, in my case, skin cancer and dermatology. Would you have any comment on that, Julie?
I get excited when I hear comments like that because I think that means you've got a good understanding of the different parts of your business. And I think well, my initial comments, I'm very curious to know why you would split it. I think it's really good to understand. Obviously, general care is very different pricing to those subspecialties. And so if your view is that you would split it, you've obviously got a good reason for it. I think it would be really interesting to do some analysis around how your costs are driven in each of those areas to work out where you put your future efforts, which if you were to split it, is it a different cost structure? Therefore, is it a different management structure? And therefore, where would you put some future investment? So if that's your comment you'd like to split, I think that'd be a great place to start to talk to your advisors about your reasons why. And does that change anything for the future as to where you put your focus?
Thanks for that, Julie. This one's for Ben. Can telehealth be used freely, especially during bushfire periods, i.e. bushfire periods with patients without access? Sorry.
It can be. The telehealth system is not charged per patient. It's charged per doctor. So the only real thing is remote access to data. So if a patient has access to their mobile phone and they have a 4G connection, they'll be able to do a telehealth consult with their doctor. In the case of no reception, yeah, you're going to have a bit of a problem, but the patients in our system don't get charged for access. It's the doctor, and he can have as many patients as he wants on it to have a telehealth consult.
Thanks, Ben. Okay, the next one, I think probably for you, Julie. We are excited about innovations, but the doctors may differ in the way to handle them.
Yes, and I think I would say that you're not alone in the industry, in that this is an issue, I think, for all professionals across all industries. Having been in accounting for a number of years, I think that it is... My younger colleagues have a lot to teach me about innovation and technology because it wasn't something that I was used to in my early career. And so I think my view is the more that you can talk about it and the more that you can help doctors to understand how innovation may help them in their practice, because every doctor that I've ever met has always got at their heart and soul patient care. So it's really around how will it help them deliver patient care and how can you support them with that very human aversion to change management. And I think sometimes practitioners that are more established, speaking for myself, when I look at all the technology that's around to help us help our clients, when it's not your thing, technology is not, I didn't do an IT degree. Ben and I were talking about this at the start. I didn't do an IT degree. And so it's really trying to find people. I need IT guys alongside me to help me understand how to use that technology so that I can help kind of push myself into that change. And for me, it's all about what does it get me to help me look after my clients more. And if your doctors, if you can help them to understand that, I think that is a way of helping them feel more comfortable with it.
Great.
To add to that, it's about building that relationship with the practice and making it relatable to them. Information, data, and innovation is there, but how's it going to help them? How is this going to make it easier? How does it actually work in their environment? And if you can show that, if you can make their life easier, a lot of the doctors will handle it a lot easier than just telling them, well, we're going to do this. Doesn't matter, we're going to do it. But if you say, hey, you do it this way, I'm trying to help you and I'll make it a little bit easier and give you the ability to do your job better, then they understand. It's a lot easier.
Okay, thanks, Ben. I think this is the last one, or there's two. Someone's asking about how to view previous webinars. I'll send you a link to the previous ones, Michael. We do have them on our YouTube channel at the moment. We're in the process of building a new website, and soon they'll be in one content area that will be easy for you to access all of our historical webinars. hopefully by the first week of December. I'll send you out an email with a list of all of the past webinars and a link to each of them, everyone that's in the session. Okay, next question. New doctors who were registrars now demanding higher percentage fee, 70% rather than the current 65%. How to deal with that? Any suggestions, Julie?
Yes, you guys have got some great questions today. These are all the pointy end questions, and it is difficult. I absolutely acknowledge that, and part of what's difficult about it, the newer doctors, particularly the registrars, may, depending on their circumstances, they don't necessarily have had experience before around the cost of running a business. So my view is, I actually think it works in your favour to be transparent with doctors around those contracted doctors in your practice around, have you ever wondered where your service fee goes to? These are the things that it pays for. I'm not suggesting that you show them your profit and loss statement, but certainly I think helping them to understand where they get that value from that service fee is important, because I've talked to a lot of doctors over the years who think that it's just straight cream. They don't necessarily understand what the costs are paid, what it pays for, and the responsibility that goes with that. So part of that is an education piece. I also think that with that education gives them an understanding of how difficult it is to run a general practice and how much you can't give away too much of your service fee or your profitability is really impacted. But I think the one thing that I think goes hand in hand with that discussion, so that discussion is about value, yeah? And then alongside that, it's about how to help them develop their own practice. Because if they're going to keep 65% of it, how do you help them build their revenue so that you build their numbers, so that you build their take-home pay? And some of that might be not necessarily about giving them more percentage, but about working out what resources are available to them in the practice to help them do that. Doesn't make the question go away, I get that, but I think the more that you can educate them about the costs that are associated, the easier it is to talk to them about the levels of service fees and what's affordable, because the practice, above all, has to be sustainable.
Good point, Julie. Okay, last one for Ben. Some practitioners are too concerned about privacy, medico-legal problems, and too scared to take up that sort of innovation. For example, kiosk, if the patients use it, it will be helpful for reception, but doctors are worried about patients not reporting face-to-face. Ben?
Well, it's a kind of a two-sided thing here. A lot of patients will still want to do face-to-face. My grandparents, for example, they go to a practice where there's a kiosk. They'll always go to front desk. My wife, when she goes to the practice, she'll check in because it's easier, and she's kind of that generation where everything's on the phone, the whole lot. And a lot of practices that I see use kiosks because they want to keep their information private. I work with Women's Health in a lot of different states where the patient's coming in and doesn't want to say to front desk why they're there because they don't want other people to overhear. So it can actually help with privacy in some cases, let alone kind of make it harder for privacy. And also the information isn't going outside of the practice, it's an internal system, so it's only going into the practice management system. And sometimes the doctor might gather more information from the kiosk and the right information, because sometimes when talking to a front desk lady, she might be taking a phone call at the same time as trying to talk to the patient that's there to check in, and she might get the wrong information and give you the wrong detail. But when the patient's using a kiosk, that information is gathered from the patient directly and put into the system and carried through the user story. So I find kiosk really isn't kind of a more of an issue, it's kind of a helper. And sometimes practices think a kiosk is going to take over a receptionist's job, and it's not. It doesn't replace a receptionist. A receptionist could be doing something else. The phone's ringing off the hook and she's trying to check someone in. She can answer that phone while that patient is checking in and it just alleviates the line out the door. An example, I was at a doctor's clinic this morning. My daughter's sick today, and they were checking in. There was 4 people that check in, and there was people checking on the kiosk. And if I took that kiosk out, there would be 2 more in the line trying to check into the practice because they had a busy morning. I see kiosk as a major help in the system.
Definitely.
Hopefully that answers the question.
Thank you so much, Ben. A huge thank you to Julie and Ben for sharing their expertise with us today, and Stephen. It's been a great session. Thank you, everyone, for attending. Again, please take time to complete the survey as you exit, and we look forward to seeing you again next year with our next Practice Growth webinar. Have a great day, everyone. Thanks so much.